So today we're going to present on updates to the event level or person level vaccination forms. So as you know, just a little taking things a step back, facilities can report data to NHSN through 3 different mechanisms. First, facilities can directly enter the summary data on the data entry screen of the COVID-19 vaccination form. And this is the traditional way to enter data, entering the weekly totals on the form. Second, facilities can use CSV upload. And third, as of March 28th, long-term care facilities also have the option to use event level or person level COVID-19 vaccination forms and select the view reporting summary and submit button to submit these forms to the weekly vaccination modules. And the person level forms have replaced the optional Excel data tracking worksheet. And today we'll focus on this form of data submission in this training. So in order to track individual resident and healthcare personnel vaccination information, we currently, but actually previously provided the Excel spreadsheets called the Excel data tracking worksheets to track individual resident and healthcare personnel information and to have the weekly summary totals calculated for you. But instead, we built in enhanced versions of these worksheets into NHSN, and these are the person level or event level COVID-19 vaccination forms. So now I'm going to go through some of the updates that you can now see that were rolled out as part of the May 30th release. So I'm just going to first give a summary of all of the updates that we introduced as part of the release. Specifically, these updates relate to the person level or event level vaccination forms. So first, we included some new efficiency and speed improvements. So you should hopefully see shorter load times as a result of these improvements that were made. Another change we made is that if the individual's end date or discharge date is before 3/28, which is, as a reminder, the date that these person level vaccination forms became available. So if the end date is before that date, the rows will no longer appear green, because I know this was something that was causing confusion pretty frequently. We also aligned the reporting summary screen with the updated COVID-19 vaccination summary forms, the new questions, and with the simplification. And you'll see that the person level vaccination form auto calculates the new questions 4.1 and 4.2 on the resident form, and question 5, which is up to date, and that's on both the resident form and the healthcare personnel form. We also added a new column to indicate whether the additional / booster dose in question 4 was a booster dose or an additional dose. Additional meaning it was for an immunocompromising condition. And the reason we did this is because this information is needed for the auto calculating of questions 4.1, 4.2, and 5. And we also added columns to collect second and third booster doses. And this information is also needed to calculate the questions 4.1, 4.2, and 5. So this is an overview of what the new summary form looks like for healthcare personnel. So when you click view reporting summary and submit for the healthcare personnel person level vaccination, this is what you will see. And this is aligned with the weekly summary form that was introduced in this release with the modifications that were made there. And we had a training on the overall changes to the weekly summary forms a few weeks ago, and you can access that on our website. But in general, as an overview, we simplified the question on number with complete primary series and number with any additional or booster doses, as we removed the manufacturer-specific questions on the form, and we removed the supply questions, and we introduced a new question, which is the number of healthcare personnel with complete primary series who are up to date with COVID-19 vaccines. And if you're entering resident person level data and you click view reporting summary and submit, this is what you will now see. This is aligned with the weekly summary resident form. So again, the questions on primary series and additional or booster doses are simplified as there's no longer summary questions on the manufacturer. And you will see these 3 new questions, which are question 4.1, number of residents in question 4 who received only 1 booster dose, and question 4.2, number of residents in question 4 who received 2 or more booster doses, with the most recent dose being received since March 29th, 2022. And question 5, number of residents in question 2, or number of residents with complete primary series who are up to date with COVID-19 vaccines. So just taking a step back as a reminder, this is how up to date is currently defined for quarter 2 of 2022 for the purpose of NHSN surveillance, public health surveillance. So individuals are considered up to date with their COVID-19 vaccines during the surveillance period of October 3rd, 2021 through June 26th, 2022 for the purpose of NHSN surveillance if they meet one of the following criteria. So first, an individual is considered up to date if they received all recommended doses in their primary series and at least 1 booster dose. Second, an individual recently received all recommended doses in the primary series and is not yet eligible for a booster dose. So people who fall into this category are those who received their second dose of a 2-dose primary series of mRNA less than 5 months ago. So this means they received their second dose of Pfizer or Moderna less than 5 months ago, or those who received a single dose of Janssen less than 2 months ago. And then lastly, underneath this table, you'll see there's a third set of scenarios. And these scenarios apply to individuals who have a moderately to severely immunocompromising condition. And in general, we don't expect you to actually know this information. So this is really only provided here as in case you do happen to know the individual's immunocompromised status. So if you happen to know that this individual has a moderately to severely immunocompromising condition and they received an additional dose, because additional doses are received for immunocompromising conditions, and then booster doses are received after that. So if you do happen to know that someone falls into that category, these 3 criteria underneath the table are the scenarios that would apply to them. So an individual received an additional dose less than 3 months ago. If the primary series was Moderna or Pfizer, then they would be considered up to date. They could also be considered up to date if the individual received an additional dose less than 2 months ago, if the primary series was Janssen, or if an individual received at least 1 booster dose after receiving an additional dose. And all of this to say that everything I just went through is obviously very complicated. And it's hard to sort through, and the definition is going to change over time of up to date. So therefore, a huge major advantage of using the PersonLevel or EventLevel form is that the EventLevel form will apply these rules for you and determine who is up to date for you. So, and it will determine who is up to date over time for you, because someone could be up to date 1 week and then they fall out of the 5-month range, for example, the next week, and they'll no longer be considered up to date. So therefore, this tool is really great because it will automatically do all of those calculations and tracking for you. And just a review of the key terms of additional dose versus booster dose. An additional dose, like I mentioned, is another dose of vaccine administered to people who were less likely to mount a protective immune response after initial vaccination. And this applies to people who are moderately or severely immunocompromised. Whereas a booster dose is another dose of vaccine administered after receiving primary series vaccination to enhance or restore protection, which might have subsided over time. So most of the time, we expect any doses after primary series, they're likely booster doses. And if you can't distinguish between the two, just assume that they're booster doses. So as I mentioned, we added a new column to indicate if question 4, which is the number of people with any additional or booster doses, if this dose is a booster dose or an additional dose. So this question collects the first additional or booster dose that was received after the primary series. So in order for the application to accurately determine up-to-date status, what we need to know is whether this was a booster dose or an additional dose. So you'll enter the additional or booster dose date, and then you'll see this new column that says additional/booster dose type. And this column is going to default to booster dose because, like I said, we think 99.9% of the time, this is a booster dose and not an additional dose. So if you do not have any specific documentation of the dose being an additional dose for an immunocompromising condition, you should just assume it's a booster dose and you don't have to do anything because, like I said, as soon as you enter the date for additional or booster dose, it's going to auto-complete this new column to booster dose. And then you just go ahead and enter the additional or booster dose manufacturer. And the reason that we still enter manufacturer is because as you saw on the up-to-date slide that I showed 2 slides ago, the manufacturer information is still needed in order to accurately determine up-to-date status. So that's why it's still being collected on the PersonLevel form. And we also added new columns to collect second and third booster doses, as you can see here in this image. So booster dose 2 is the next dose received after the additional/booster dose. And just a note that if the additional/booster dose type is a booster, then booster dose 2 is considered the individual's second booster dose. But if additional/booster dose type equals additional, then booster dose 2 is that individual's first booster dose. And you don't really have to know the difference, but just putting that here so you can understand why people are being categorized as they are on the summary form. And then we also added booster dose 3, which is considered the next dose received after booster dose 2. And the reason we added this is because if additional/booster dose type is additional, then booster dose 3 would be that person's second booster dose. And just a reminder that question 4.2, which is shown at the bottom of the form, cumulative number of residents in question 4 who received 2 or more booster doses of COVID-19 vaccine, and the most recent dose was received since March 29th, 2022. So just a reminder that this question will only include second boosters received after March 29th, 2022, because this was the date of the FDA approval for second boosters. So we just want to collect recent receipt of second boosters after that date of approval. But again, you can enter any date and the system is going to apply this logic for you. So just enter the accurate dates and it will categorize people accordingly. So next we're going to talk about data entry and submission. And Heather, my colleague, is going to help us with this. So first, I'll just start here. Heather, how does one access the PersonLevel COVID-19 vaccination form?
Thanks, Hannah. That's a great question. So these forms are available to any active NHSN user in a long-term care facility that has level 3 access. So because this is person-level data, we have to have that extra level of security to allow access to these optional forms. So if you are a level 3 SAMS user and you log into your long-term care facility in the long-term care component of NHSN, you can click COVID-19 on that left-hand navigation tab and move down to select either the EventLevel COVID-19 vaccination form for HCW, which is healthcare workers, or for residents, and that will take you right to the form. And just to, Hannah, continuing with that, once we get access and we log into one of those forms, maybe if you go to the next slide, please, can you walk folks through how to actually go about entering vaccination information for an individual?
Sure. So once you click either the EventLevel COVID-19 vaccination form for healthcare workers or residents, you will see this screen. If you click Add Row, this yellow box will pop up, and you'll enter the individual's data into these boxes here at the top. You'll enter all of the required and relevant fields for that individual and click Save Row. And then once you save the row, that person will be seen down here in the grid. And Heather, how do you update an individual's vaccination information once they've already been entered into the grid?
Yeah, so I think personally, this is one of my favorite features of using these optional event level forms. We know that it's not uncommon for someone's vaccination status to change over time. And the great thing about these forms is it allows you to capture all of those statuses throughout the person's time at your facility. So for example, if we had a user that, or a resident that initially declined COVID-19 vaccination during week 1. Oh, we have an example here. Perfect. So on January 1st, 2022, this resident was admitted. And at that date of admission, we did not have documentation of vaccine. We spoke to the resident and she declined. For that reporting week, we would enter all of that initial data, her demographic information, and that declination date of 1/1/2022. Now, as the weeks go on, if nothing changes, she would continue to be counted in each week as a declination. But let's suppose that on February 6th, when we go to do she's been here for about a month and folks have been doing education and continuing to offer vaccine. When we go to do this reporting, she has received her first dose. So she's decided to get vaccinated and she receives her first dose of Moderna on February 6th. We don't need to delete the row of information that shows her declination date like you did with the optional Excel tracking workbook, because this is capturing all of her information over time. You also don't delete that declination date. So she still counts as a declination through all of January. But what you do is you just simply go in and update those 2 cells under dose 1 vaccination date and manufacturer to show that on February 6th, she received that first dose. So then for future weeks, she will be included as having a partial vaccination. And so Hannah, once we enter all this great individual level data, since the requirement is still to submit the weekly summary COVID-19 vaccination data, how do folks get that information from this optional form to the summary modules?
Right, and this is a really, really important point. So by entering the person level information, that alone does not submit your data to the weekly summary module. What you have to do is enter the person level information in the grid, and then you are going to click View Reporting Summary and Submit. And this will take you to the reporting summary page. And the totals here on the reporting summary page are auto-calculated based on the person level data. And what you're going to do is use the week of data collection drop-down menu to view the data by the reporting week and see which weeks you want to submit data for. And we're going to talk about this further in a couple slides, but just a note that you should never submit data for prior weeks using the reporting summary if you do not have complete person level information for those prior weeks, because what you're going to do is you're overwriting the data that you submitted for those prior weeks with new incomplete data. So that is not what we want to do. So you should only click weeks here with the reporting summary that have complete person level data entered. So you can click on the week of data collection drop-down menu and see which weeks you want to submit data for based on any changes that you made to the person level data. But as a reminder, even if it says changes were made, don't submit for any prior weeks before you started using this person level form, because you're going to be overwriting your previously submitted data with new incomplete data. Heather, do you have anything to add to that?
No, so I'll just summarize what you've said, because this is a really important point. Sometimes it's helpful to hear more than once. So for example, if I personally used this data tracking worksheet for my facility, starting with the week of May 16th, and I don't have complete resident data for the week of May 9th or May 2nd, because I've had some admissions and discharges between then and May 16th. even though this dropdown says that changes were made to those 2 weeks, I would ignore that. So mentally, you need to know what the first week that you have complete data is, and those are the weeks you're submitting data for. So this will let you know if there have been updates, but only your facility knows when you started using the data and when the form is complete. So I would only be reporting for weeks 516 and 523.
Yep, thank you. That's a great way to summarize it. And we'll go into more detail on that in a couple slides. But again, just going back to how to submit data in general, once you click the week that you're interested in submitting data for, you will click the week, review the totals, and then click Save and Submit Data. And then you will get this alert that says successfully saved, and you'll click OK. And then if there are any other weeks that you want to submit data for, you'll click the drop down again and repeat. And this slide here relates to everything we were just talking about with when you should and should not submit data to the reporting summary. So we receive a lot of questions about why are my rows remaining green. So I just wanted to make this point really clear that it's okay if your rows remain green. And there's a number of valid reasons why your rows may remain green, even after you've submitted for the weeks of interest. So the rows will be green after they have been added or modified, and they'll remain green if they have not been submitted to the weekly reporting summary for all weeks that the individual was in the facility. However, this will often happen when, for example, you started using the EventLevel form on May 16th, for example, but this form has been available since March. So a person, if an individual has been in the facility that whole time, it might still be green if you've only submitted for the recent weeks with the EventLevel form, and that's perfectly fine. And we understand that this was intended to be something that was useful for users to try to help organize and make sure you're submitting data for all weeks where things have been modified, but it seems that it's causing a lot of confusion. So we're actively exploring ways that we can modify this and make it less confusing for users. So just reiterating that you should only select View Reporting Summary and submit weekly COVID-19 vaccination data for weeks that have complete person level information entered in the grid. It's perfectly fine for rows to remain green. All you have to make sure is that you're submitting with the reporting summary for the appropriate weeks that you have complete person level information for. So do not submit for earlier weeks that you don't have complete person level data for, because this overwrites your previously entered weekly summary data with new incomplete data. So for example, if a facility begins use of the EventLevel form the week of May 30th, 2022 to June 5th, 2022, then the facility should only use the EventLevel form and reporting summary to submit data starting from that week moving forward. They should not submit data for any weeks before May 30th because it's likely going to be incomplete and it's going to overwrite the data that the facility previously submitted. Heather, anything to add here? I think we agree that this is one of the most important points we're going to make today.
Yeah, I would just stress that, as we said on the last few webinars, this is a new optional tool to make things more user-friendly for folks. With any new tool, there's going to be some changes along the way, and those are being made based on user feedback. So thank you for your patience. Please keep letting us know what's working. But yeah, this is really one of the biggest points of the day.
Yeah, the feedback that you've all provided has been extremely useful, and we're actively incorporating it into the modifications that we're working with the developers on. And our goal is really to make this as useful and user-friendly as possible. So keep the feedback coming, and we want to work with you to make this work. So Heather, after I've used the weekly reporting summary to select a week and submit data for that week, how can I check if this data has been officially submitted and saved?
Yeah, so when you're clicking View Reporting Summary and Submit, you're submitting those data to our weekly COVID-19 vaccination summary modules. So what you would do is you would navigate to the vaccination summary tab, and then any week that you've provided data for, if it was successfully submitted over, it should show as green here in the calendar view. You can click on any one of those weeks for residents or healthcare workers and also see the create date for that submission. So you can see the date that it was submitted as well.
And if you click on the week in the calendar view, you can see the official weekly summary form. And what you should see is that the numbers that were entered in the reporting that were on the screen in the reporting summary have now populated the official weekly summary form. So just another point is that the reporting summary screen directly feeds the official weekly summary form. So if data is submitted using the reporting summary, it goes straight to the weekly summary form, which you can access from the vaccination summary tab. And now we'll go into some frequently asked questions. Heather, are the EventLevel or PersonLevel vaccination forms required?
No, and I've been seeing this come up a lot in our live Q&A today as well. So just as a reminder, we covered this as one of the first slides in the presentation today. These are optional tools that can be used to report data to those weekly COVID-19 vaccination summary modules for healthcare workers and residents. We think that this will make things a lot easier for you guys, especially when it comes to tracking who is or is not up to date. But if you choose not to use the EventLevel forms, you still have two other ways to submit that weekly vaccination summary data. You can navigate to COVID-19 on that left-hand blue tab and then click the COVID-19 vaccination residents, or HCW, which stands for healthcare worker. And you'll be taken to the calendar view where you can click the week of interest and fill out that COVID-19 vaccination summary form directly in the application. Or if you scroll all the way to the bottom of that, that's where you can find the option to upload your CSV file. So if you're a facility or group that uses CSV upload, that is still an option as well. Hannah, why might somebody choose to use this optional tool instead of some of the other methods that we've talked about?
Yeah, so I think the major advantage of using this tool is that once you get the hang of it, it can really simplify the reporting of the summary data, because users who choose to use the EventLevel, PersonLevel vaccination forms no longer need to manually calculate and enter the totals in the summary forms. Whereas people who use the EventLevel or PersonLevel forms will have the NHSN application automatically calculating and displaying the weekly totals for you. And this includes classifying individuals as up to date, which is the new question on the weekly summary forms. Users simply need to update and maintain the PersonLevel information. And at least once a week, you click View Reporting Summary and Submit to select the most recent week, review the totals, and submit the weekly data. In addition, this tool is really great because it captures changes in individuals' vaccination status over time. This tool also allows facilities to document vaccination information at the person level. And this is something that we've heard that a lot of facilities are doing in one way or another, maybe using spreadsheets or some other tool on your local computers. So this gives you a place to document all of that information with the additional benefit of having the weekly totals calculated for you. And this tool also allows users to record religious exemptions, which is something that was frequently requested, especially for healthcare personnel. And Heather, if I can't see the EventLevel or PersonLevel COVID-19 vaccination forms when I log into NHSN, why might this be?
Yeah, this is a question we see a lot, and I've seen in the chat today as well. The most common reason you would not see this form is if you do not have level 3 access or you are not logged in using your level 3 access. So if you don't see these two options in the dropdown for COVID-19, your next best step would be to contact the SAMS help desk to increase your access from level 1 to level 3.
And this is an example of what a level 1 user would see when they log in. So if your screen looks like this, you're probably a level 1 user, and you can see up here in the upper left corner, NHSN level 1. On the last slide, we gave the specific instructions for how to request level 3 access. Heather, is reporting completed automatically based on the data that's entered into the EventLevel COVID-19 vaccination forms, or do I still have to submit the weekly vaccination form, or do I still have to submit data weekly?
Yeah, so you should go in and click that View Reporting Summary and Submit option at least weekly to submit your data to the summary, the COVID-19 weekly summary modules. Remember, if you don't click View Reporting Summary and Submit, any changes you make using this line level form will not be sent over to the weekly summary modules. And Hannah, how far back can folks use the EventLevel data submission tool? And I also would add, just on some questions that I'm seeing in the chat, if maybe we could revisit the clarification we made about when you might not want to submit as far back as you're able to.
Sure, yes. So you can submit as far back as March 28th, 2022, because this was the first week when this tool was rolled out. And our reminder was that you should only submit for weeks that you have complete person level data for. So with the example that Heather gave earlier, for example, if 5/16 was the first week that she started using the person level tool, then she should submit for the week of 5/16 and then the week of 5/23 and every week going forward. But since she didn't start using the person level form for weeks before 5/16, it's not a good idea to use this tool to submit for weeks before 5/16, even if it says something like never submitted or changed since submitted, because the person level information might not be complete for those prior weeks if you didn't start tracking your person level information until 5/16. So it's just really important that you only use this tool to submit for the weeks that you have complete person level information for. And it's okay for person level rows to remain green if you're just not submitting for those prior weeks because you don't have you don't have data on all of the individuals who are in the facility those prior weeks.
And if someone wants to check to see if they're not sure if they might have submitted for a week that they didn't intend to, I would recommend that you run a line list or look in that calendar view of the summary data to see what those previous weeks look like as far as totals, so you can make updates as needed. We can drop in the chat a link to some instructions on how to review, create dates, and view those summary data on the summary calendar view. And we remain available for questions and troubleshooting through NHSN at cdc.gov as well.
And Heather, what if I need to update a record that I previously saved?
Yeah, so maybe you've entered in information and then realized that it was incorrect. So it's not a change in status that actually happened over time, but there's some sort of error that you made. That's very easy to fix, no problem. You're just going to go ahead and click the cell you want to change. So in this example, I had entered the patient's name incorrectly. So I'm going to click that cell and type in second, which we're saying is his actual last name. And then once you make any updates that are needed, you'll click out of that cell and then go back up to View Reporting Summary and Submit, and resubmit for any of the affected weeks that you have complete data for. So in our previous example, I would resubmit for weeks from 5/16 moving forward. And Hannah, this is another question I've seen a lot today. How do we indicate if there's no delete button? I can't remove somebody once they're no longer at my facility. So how do I update this row when somebody no longer works for me?
Yeah, that's a great question. So what you're going to do is you're going to add their end date, it's the end of employment date, to their existing row. So first you'll click the column that says HCP end of employment date, and you'll select the date that they stopped working in the facility. And that's all you need to do. That will take care of it. Anyone who has an end date will not be included in the reporting summary for weeks after their end date. So you don't have to worry about deleting people or anything like that. You simply just add their end date, or for a resident, their discharge date, and that takes care of it. And just a tip, you can sort the rows by end date or discharge date so that all of the individuals with an end date will be at the bottom, and they won't clog up your view in the grid. So you can look at all of your people who are currently in the facility grouped together.
And just as a follow-up to that, why do we want to enter an end date instead of removing their row entirely?
Yeah, that's an important point. And the reason that we want to enter an end date instead of completely removing the row is because we want this information to be accurate over time. So for example, this person worked in the facility, let's say from 4/6 to April 8th, 2022. So they worked there for a long time. So we want to make sure that if we were to look at the data for the first week of April, even though that was a couple months ago, we want this person to be counted, even though they no longer work there. But they did work there for that first week of April. So we want to make sure that their data are being counted for that week. So let's say they were fully vaccinated, they should count for towards the fully vaccinated question for that first week of April. But because they have an end date, they will not count towards any of the questions for the next week. So beginning with the week of April 11th, will no longer count for any of the questions. And we want the data to be accurate over time. And Heather, if a healthcare worker goes on leave, how do we account for that?
Great question. So we are applying the same definitions here that we apply when we're completing the weekly summary form. So this is not new guidance, but how we're applying that to the event level form. If someone goes on what we consider to be temporary leave, so 2 weeks, 14 days or less, we don't change anything in their row. Their information is still maintained in that row. Nothing needs to be done. However, if someone goes on extended leave of more than 2 weeks and then returns, for example, someone goes on maternity leave, you would enter an end date on the day that they went on extended leave. And then when they return to work, you're going to make a new row for them with a new start date on the day they return. We know you might not always know right away that leave is going to be extended leave. So you might be going back and doing this retrospectively, and that's okay. But essentially, folks continue to contribute until that leave is longer than 2 weeks or 14 days. Anything you would add there, Hannah?
No, I think that was a great description. Thank you.
All right, and similar to that, Hannah, can you walk us through how to account for resident discharges and readmissions?
Yes, so with residents, if the resident is discharged or leaves the facility for any reason and then returns or is readmitted within 1 week or 7 days or less, so nothing on the row needs to be changed and their information can continue to be maintained on the original row. However, if a resident is discharged or leaves the facility for any reason for longer than 1 week or longer than 7 days, and then later returns or is readmitted, you should enter a discharge date on the day they were discharged or left the facility. And then when they return or are readmitted, you're going to use the plus button next to the row to duplicate their row and enter a new admission date on their new row. And this is also consistent with our weekly summary form guidance that says to count all residents occupying a bed at this facility for at least 1 day during the week of data collection. And Heather, can you walk us through this example of a resident who was discharged and then later readmitted after more than 1 week?
Yeah, absolutely. So we're looking at the fourth example, Mr. Jones. And the first thing we're going to do is click on that third column, the resident discharge date, and enter the date that they were discharged. We'll say he was discharged to the hospital on 5/2. So we'll put that in. Once we've made that change, we'll click out of that cell, resubmit his data. Now, let's suppose that later on, just a few weeks later, we find out they are readmitted. So what we'll do next is we're going to find the resident in the table, and we're going to click the plus button on the far left-hand side to duplicate the row. And that's going to copy over all of his existing information, so you don't have to worry about hand keying in vaccination dates again. And it will pop up in that yellow box at the top of the screen. Now, the only thing you need to do here is quickly review and make sure he hasn't had any status changes, any changes in the number of vaccines he has received. And then you'll delete the discharge date and enter the new resident admit date. So in this case, he was readmitted on 5/22. And then lastly, once you make sure all that information is correct, you'll click Save Row, and he'll be added as a new row here, and you'll be ready to click View Reporting Summary and Submit once all other updates for the week have been made.
Thanks, Heather. Yep. And actually, one other update we made in this release is that you no longer have to delete the old discharge date and admit date when you duplicate the row. Those fields are going to show up as blank, and everything else is going to be copied, so that all you have to do is enter the new admission date. You don't have to delete that. So that's another improvement that I did fail to mention earlier.
Perfect. Thank you, Hannah.
Sure. And this table is just a summary of everything we just went over in the past couple slides. So I'm going to skip over it for now, but it can serve as a good reference for you. Heather, I know we already talked about this, but let's cover again. If I entered incorrect data mistakenly and click save, can the row be deleted?
No, so we don't currently have a delete option, and that's because, like we mentioned when we went through the discharge examples, we want to make sure that folks continue to contribute to any prior weeks that they were at your facility for. Now, we know sometimes it's truly a data entry error. So maybe you accidentally entered somebody twice, or maybe you realize you entered a staff that does not regularly work at your facility and doesn't need to be counted. For whatever reason, what we recommend is whenever possible, you repurpose that row. So you would just enter somebody else's information over that if you've had any new hires or new admissions that week. If you don't have any new records to enter for this week, what we recommend you do is make it really clear that this is a mistake by modifying the comments. I also, in the example here, have updated the name to accidentally entered. And then you're going to change that unique identifier as well, so it's not associated with anyone at your facility. And then the most important part here is to change the discharge date to a date before 3/28. Because remember, you cannot submit event level data to the summary form before 3/28/22. So if you change that date, in this case, we changed it to a date in 2020, this will remain in your event level line list, but will not be submitted for any summary reporting. And Hannah, related to that, I mentioned in that example, maybe you included a staff member who you did not mean to include on that list. Can you give folks a refresher on which healthcare workers they should be reporting data for?
Yes, so as a reminder, we are using the same instructions for entering data in the event level form as we do for the aggregate weekly summary forms. So you should refer to our table of instructions for questions about who should be included in your person level data. But in general, you should only include data on individuals who are eligible to work in the facility at least once per week. And these are the people who regularly work in the facility on a weekly basis. So this does not include people who maybe work in the facility once a month, or they're not regularly scheduled to work in the facility. Those individuals would not be included. So please refer to our table of instructions and frequently asked questions for some examples and more information on who to include. And Heather, we've seen this question come up. Does the resident identifier or staff identifier that you enter need to be the same as the one that individuals use to enter in the point of care testing results or any other person level results that they're entering into NHSN?
Yeah, we absolutely would encourage that you use the same identifier whenever possible. This will make linkage between other NHSN pathways and modules easier in the future. So we do plan to do that linkage. Just some general reminders about choosing a resident or staff identifier. You should select something that is unique to that individual. So you don't want to just use a room number, since multiple people could occupy that room number over the course of time. We provide one option here just as an example, but again, any convention that your facility uses, especially if they already use it for point of care or another method or another form in an HSN, is totally acceptable. So this example here, we're using a combination of initials, birth date, and room number. So for example, if I had an individual named Jane Test, born January 5th, 1980, currently in room 201, and that was the unique identifier my facility had chosen to use, her identifier might look like this, with the 2 letters for her name, the month, day, year for her birth date, and then room 201 appended to the end of that.
And I'm just going to go through a couple slides quickly since we're running short on time, but to enter a religious exemption, you count these individuals with a religious exemption or declined for religious reasons are counted in the declined category. So after you entered the decline date, you'll then be prompted to enter the declined or declination reason. So that's where you can click received official religious exemption. And do I submit data every time I add or modify data, or only weekly? You do not need to submit every single time you add or modify data, but you do need to submit to the reporting summary at least once per week. So it's really important to remember, even if data have not changed week to week, you need to click view reporting summary and submit and select the latest week that you're submitting your data for, just like you would with the normal weekly summary form. Can I sort the columns? Yes, you can sort. You might find it helpful to sort by columns, such as the discharge date or the name of the individuals, or the identifier. So there's a lot of different sorting you can do. You just simply click on the name of the column, click in that box, and it will sort in ascending order. And then if you click again, it will sort in descending order. And Heather, I think we should spend a little bit of time on this. We've received a lot of questions about users who currently use the optional Excel data tracking workbook, and they're wanting to transfer this data over to the NHSN EventLevel COVID-19 vaccination form. So the Excel data tracking worksheets are being retired for long-term care facilities. And during the early transition phase, we provided one-time instructions on how to upload the data tracking worksheet to the EventLevel vaccination form. But you should no longer transfer data from the Excel data tracking worksheet to the EventLevel COVID-19 vaccination form beginning with the week of 5/30 to 6/5. And this is because the Excel data tracking worksheet is no longer being updated for long-term care facilities and does not have columns for second and third booster doses, therefore. So if you want to transfer your Excel data tracking worksheet over, it will have to be for weeks before 5/30, or the other option is that you can either directly enter your data into the NHSN EventLevel form, or you can use one of our CSV templates for uploading data directly to the NHSN event level form. And Heather, do you have anything to add to this?
Yeah, I think the only reminder that I'll add here, the reason that you don't want to continuously resubmit using the Excel tracking worksheet, I've seen some questions, can't I just keep using that and re-uploading it every week, is because that Excel tracking worksheet is only meant to capture the residents or staff status for that current week. It doesn't look at data over time. So it's really important that you just use that initial upload. If you have the week of the last reporting week, so the week ending 5/29, you can go ahead and transfer that data over. But once you've done that initial upload, you should either directly enter that data or use our CSV templates to do historic upload. I know that's a transition, but as some people in the chat have said today, we've had some really positive feedback that the hardest part is that initial information, getting that entered in. And once you do that initial upload or data entry, all you have to do is look for what changes made over the last week and click submit. And thank you to those of you who have been saying that this has saved you a lot of time, because I know it can feel really confusing in the beginning, but just want to share that's live user feedback we've received today.
That's great to hear. Yeah, and if you need guidance in terms of your initial upload or entry of all of your people for the first time, please reach out and we are happy to help you. We want to work with you to get it right. So as I mentioned, you can upload data via CSV. So if you go to the long-term care NHSN vaccination website, there's a whole section related to the CSV files. We have a CSV user guide for the event level forms. And we also provide a CSV template and an example CSV file. And if you navigate to the website now, you'll see that there are updated versions of these that say May 2022. So you can upload data using our CSV templates for event level data. So you'll just click the upload CSV button and import the CSV file. But you need to make sure that your data in the CSV file matches the formats and values in the template. And just a reminder that when you click upload CSV, the data that gets uploaded will overwrite any records in here in the grid with the same identifier and start date. So just keep that in mind. And anytime you have an identifier, every identifier needs to be unique for an individual. But if you're re-uploading the CSV every week, you're going to be overwriting the data. Heather, what if I have no changes in my data since the previous week?
Yeah, so even if there are no changes, in order to transfer that information over to your weekly summary form, you need to go in and submit for the most current week. So you should still go in, review your data, and submit at least once a week. So in this example here, if it was May 10th and I'm entering my data for week ending, or sorry, April 10th and I'm entering my data for week ending April 11th, even though I didn't have any new admissions or discharges, I'll still go click that week here, review the totals, and click view reporting summary and submit.
And we've seen this come up a few times for CSV upload or direct data entry. You cannot list more than one date in one cell. Instead, you should just list the earliest date that an event occurred. For example, if a resident declined vaccination on 2/1 and 3/1, you should enter the decline date of 2/1. And you do not need to enter anything on 3/1 when they declined again because nothing changed. Their status is the same. So instead, you should just enter 2/1 as their decline date. And a reminder of our resources, please see our NHSN website. We have a lot of resources there, event level trainings and CSV templates and CSV example files. And also our general resources. Remember to look at our table of instructions and frequently asked questions, as these contain a lot of helpful information. And I know we don't have a lot of time left, but anyone on the NHSN team seeing certain questions coming up again and again that would be useful to go over now?
Yes, thank you, Hannah. We've had some questions about being able to print the EventLevel forms and review the data that way. Could you speak about that?
Sure. So let me see. I think the best thing you could do in that case would be to export your data. That would be my suggestion. There, right next to where the see where it says upload CSV, there's also an export CSV button. So when you can export the CSV and then look at all of the data that you have entered, and that might be a good resource. Heather, do you have any other thoughts?
No, I would say that's the best resource for now. And as the time passes, we are looking for other ways to improve features. So for now, that would be the best option, but stay tuned. One question I'm seeing a lot of, Hannah, if I have never used the EventLevel vaccination form before, but would like to start, do I have to go back and enter all of the previous data I have on previous Excel spreadsheets or all data on all residents dating back to December 2020 before I can start using this optional form?
No, absolutely not. All you have to do is decide, I'm going to start this week. And what you will then do is enter all of the data for residents who are currently in the facility as of this week. You don't have to worry about people who are no longer in the facility. But the big caveat is that if you start this week and enter person level information for all of the residents who are in the facility as of this week, you should not use the view reporting summary and submit and select weeks that are before this week to submit data, because then you would be overwriting those prior weeks of data that you've already submitted with data that's incomplete because you only have entered your person level resident information as of this week. So you don't want to use it to submit data for prior weeks. So our suggestion is to pick a week where you're going to start. Make sure all of your person level information is updated as of that week, all the people who are in the facility as of this week, and then start from here going forward.
Thank you, Hannah.
Yeah, thank you, Hannah and Heather. This was a great presentation today. It looks like we're at 1 p.m. So just wanted to close out the webinar and thank everyone for their participation. Please send an email to nhsn@cdc.gov, and you can put COVID-19 vaccination in the subject line of your email, and we will be happy to assist. Thanks again, and good afternoon.